I'm going to talk first about the scientific aspects of addiction, and then I'll talk about the Christian aspects of addiction. Because in Christian belief, addiction, the root of it is a spiritual disease. According to data obtained in 2020, about 57.3 million people 12 and older used illegal drugs in the past year, and about 58.7% or 162.5 million people have used alcohol, tobacco, or illegal drugs in the past month. People may not try a cigarette, alcohol, or drugs to get addicted, but it can be an unfortunate consequence of trying it. Typically, people will use these substances maybe from peer pressure, maybe to remove some of the pain or sorrow that's in their life, maybe to get a high or increase enjoyment or satisfaction or pleasure in their life. So in the Psychiatric Diagnostic Manual, there are several different types of substances people can be addicted to. Nicotine, caffeine, alcohol, opioids, stimulants, hallucinogens, sedatives. There's a lot of different types of stuff there that people can be addicted to. Over time, the amount that the person takes of that substance will not have that same effect. For instance, if it got them high, it will not get them high any longer. Or if it took away some of their pain or worries, it won't take them away the next time they use it. So they need to go up a little bit higher on the dose. There's a technological term for this called tolerance, and that the person's mind or body has become tolerant to the dose, and so they go up higher on the amount they use so that they can get that high or take away the pain or whatever effect they want. The addiction pathway in the brain starts in the area of the midbrain, and where it produces a molecule called dopamine, and dopamine is known as like the reward molecule or the pleasure molecule. Essentially, it secretes dopamine up through the front part of the brain around the area called the prefrontal cortex, which deals with like thinking, planning, organizing, and this front part of the brain can communicate and talk with basically the other parts of the brains to help control movements, desires. It can also help regulate emotions and feelings and help direct the thoughts. And so really, when you use these substances, it sort of activates these pathways. So you can kind of get the feel for just how much these substances can really hijack one's thinking and planning and even their movements and their behaviors and what they do. We find people will go to amazing lengths when they get addicted to a substance. They may lie, they may cheat, they may get violent, they may kill, they really just become like almost different people, for example. Some other terminology about addiction: the person's body will physically or psychologically get dependent on the substance, to where if they don't have it, their body is just going to go like through this withdrawal symptom. It's not going to be the same. And so they really got to keep kind of that continuous behaviors to have that substance or have that craving or whatever it is they're using. So yeah, there's a lot of factors to take into account when someone is addicted to drugs. Is there a family history of addiction? Did they learn that sort of behaviors or actions from their parents or people who cared for them? Are their friends or family enabling some of those behaviors? So all of these are taken into account when someone evaluates somebody who's addicted to a drug, alcohol, or some sort of substance. And so really it needs to be evaluated by a case-by-case basis. Also, once people have used drugs or alcohol or have used these substances for a prolonged period of time, it can actually cause brain changes that may need mental health treatment. Like maybe after using the substances, they'll need to be on medications to help restore the imbalance that the drugs have caused in their brain. Sometimes it can take several months of a period of sobriety to know if there's really any underlying mental health condition that maybe is contributing to someone using drugs or alcohol or so forth. So back to this principle that maybe some people use drugs or alcohol to take away some of their sorrow or pain. The Christian principles is that the source of pleasure and joy and comfort is through God and Christ, and any pain or suffering or sorrow that's kind of inherent in this life on earth, Christ will help someone to deal and to cope with that. You don't have to look into a substance, you don't have to look into drugs, you don't have to look into alcohol. You have to focus on Christ. And the only true source of pleasure and comfort is living a good, holy life and being in a close relationship with God. It doesn't mean there's not going to be pain or suffering or frustration, but it means you can present those pain and suffering frustrations to Christ and God Himself. You don't have to cover it up with a chemical or with a foreign substance. You know, I have a whole video dedicating how Christ dealt with these negative emotions and these challenges, and with life in a healthy way. You can click on that link above for more on that topic. So another interpretation I've come across about the root of addiction is that since Adam and Eve sinned in the Garden of Eden, that caused death, disease to enter into mankind. They were initially created to live in union with God and just had peace, comfort, joy. But after that, once they became separated from God, then anxiety, fear, shame, all those negative emotions and feelings entered into their life. And now through Christ gives us the opportunity to reconcile and be back with God once again. Although people who don't actively pursue that relationship with Christ to get back together, it still leaves this void in their life. It leaves a void that they may try to fill with food, with sex, with money, or with drugs or alcohol. And it's people filling that void in their life with those foreign chemicals or substances that can lead one to be addicted. So it's the Christian belief that only Christ can fill that void. In summary, these substances can cause chemical changes in the brain and mental health issues. And so I'm not saying that someone shouldn't necessarily need mental health treatment if they're going through these things, but in the process of having mental health treatment, be sure to have the spiritual treatment as well. It's going to be the combination that's going to provide health and healing.